everyone. Happy Friday. It's Dr. Amy Ostick here with Health and Healing Direct Primary Care.
Dr. Brian Ostick, emergency medicine physician.
And we are here week 15 into our pandemic and shutdown here at LA County for COVID-19 coronavirus. And it's been a crazy week. Brian, we saw this little bit of a slowing of our daily death rate in LA County. We went from a daily death rate of like 50 to 40. Then we had 18 daily death rates in a row while our cases were going up. So our case fatality rate dropped significantly, which is also a good sign. But in the last couple of days, we went kind of upticked again to 38. Then yesterday we had 42 deaths in LA County yesterday from COVID-19. All total, we've had 91,467 cases of COVID-19, at least confirmed by PCR testing in LA County, and 3,200 deaths.
And unfortunately, it looks like this is going to continue. If you talk about the way we flattened the curve early in the course of the coronavirus pandemic, we didn't see that huge spike like they did in New York City or in Italy, but we are seeing now this kind of flattening of daily case rates and daily deaths that seem to be plateauing. And I think that's probably what we had hoped for, but unfortunately it means we're going to be here for a while.
Yeah, we are. We're definitely going to be here for a while. Coronavirus is not going anywhere anytime soon. We may be sick of it, but it's definitely not done with us. And when I started these videos, I think the first video I said it's not a matter of if, it's a matter of when you are exposed. So what all we can do, the cat's out of the bag at this point.
Yeah, I saw patients in the emergency department yesterday. One of them was very sick, and a lot of them were not that sick, and we were able to send those patients home. But we sent them home saying, make sure that you self-isolate. You got to make sure that you're wearing your mask, washing your hands, because we don't want those people who are likely positive for COVID to spread it to other people in the community.
Right. And so all we can do now is behavior change,
right.
and really modify and mitigate our cases and our subsequent fatalities and mortalities from this virus by controlling our behaviors.
What can we do? What can we do to fight against coronavirus?
We can put a mask on it.
Okay.
And the IHME, which is an organization that's been tracking all different types of data when it comes to coronavirus in terms of ICU bed availability by state, by country, hospital utilization, and hospital availability when in terms of capacity to take care of sick people. They also have a great graph that looks at what our cases do for COVID-19, and then obviously our subsequent fatality, mortality from COVID-19, what happens when we mask it. And at the end of the day, there is just no argument about it. We significantly reduce our spread from this virus when we put a mask on it. And the curve goes from kind of here in terms of our fatalities and our daily death rate to it drops significantly by about a 5-fold decrease.
Yeah.
So I know it's not it's not a political bend to this. Really, it's a matter of preventing other people. You're wearing a mask to prevent the spread of droplets to another person. And so the only way a mask policy works is if it's universal and everybody's doing it. So I wanted to just kind of go over a couple of different types of masks, because I see we have a mask policy in our office, and you obviously in the ER wear a mask all day. First of all, there is absolutely no health detriment by wearing a mask.
Right.
All of that garbage about inhaling CO2 and bacteria that come out of you, none of that is scientifically true at all. These masks, can filter air in and out, and so you will breathe out CO2, and the bacteria that just came out of your mouth is in your body all the time. You're one walking microbial machine, so that's not going to get you sick. So that's number one. Number two, types of different masks. Okay, let's just start with this. This really and truly, at the end of the day, when you're going out in public, is fine. It's just a covering over your mouth to prevent respiratory droplet spread.
You look like you're about to rob a bank.
I know, but
You're like an outlaw.
I'm an outlaw. You'd be an outlaw if you didn't wear anything. So don't be an outlaw. Wear a mask. So this is fine. It doesn't have to be triple layered. It can just be a single layer. It can be a piece of t-shirt material with ear holes for your kiddos that really have a hard time keeping it on. Then these are just your basic surgical masks, and these are becoming more and more widely available. So I'm not too concerned with patients coming in here that aren't in the healthcare field.
That's what I wear when I go to the
This is what
grocery
you wear.
store.
This is what you would wear to, again, prevent respiratory droplet spread. It is not going to prevent you from, if somebody's coughing with COVID-19 all over you, from getting COVID-19.
This is actually what I wear in the emergency department throughout my whole shift, unless I'm going into our hot zone, which
Right.
is the area where we keep our COVID patients that
Right.
are basically known to have COVID. And in those situations, when I'm going to the hot zone, I put on an N95. But for the rest of 95% of my shift, I'm wearing this.
But if a COVID-19 patient is wearing this,
Mhm.
that definitely prevents the spread of COVID-19. So if when we talk about prolonged risk exposure with healthcare workers, we always ask if the patient was masked. Because if they're masked, then their risk goes way down.
Our protocol at the hospital now is as soon as the patient arrives, we give them a mask like this. And
Right.
every patient gets one of these, whether they have COVID or not.
Good. Awesome. And there's like some nifty, whatever, nylon types of neoprene mask. Those are fine too.
They're
Cover
cool.
your nose.
It's very, very fashionable.
Very fashionable. Okay. N95s. There's all different sorts, and this was a big issue in terms of supply in the beginning too. This is a one type of N95 mask, and these are filtered, right? So this is what you would wear as a healthcare worker when you walk into a room with a COVID-19 patient. And this is what I wear when I do my swabs, because the swabs obviously have a risk of inducing a cough reflex, which can then project respiratory droplets into the air and into my mucous membrane. So I always wear an N95 when I do that.
And these fit much tighter around your face so that no air can get in or out from the sides. And they're manufactured so that they have very, very, very small spaces there so that basically the virus can't get in when you're breathing in.
Right. These are really, technically, they should be fitted, if you work in a hospital setting, you get fit tested, and there's different sizes. But really and truly, this is an N95. This is another type of N95 mask that you may see. It's also kind of fitted because it has wires all around it. This is what I've been seeing a lot of people wearing. And this says N95 on it. And these are things that are sold at the hardware store, and a lot of my loving, well-meaning patients have given these to me. But here's the problem with these. These are a one-way valve mask. And so these actually really...
This piece is the valve.
Yeah, this is the valve. So these are really meant for cleaning out your garage, and there's like rat poop everywhere, or and to filter particulate material from coming into inhaling it. So it filters out that particulate material through this. But when you blow it out, it's a one-way valve, so it blows out unfiltered, all your air and everything. So this is absolutely useless when it comes to preventing the spread of COVID-19.
So you're saying if I see somebody wearing this in public, they're protecting themselves from pulling a virus into them, but when they blow out and they have a virus inside them, they're going to be spreading that everywhere.
Yeah, it's pretty useless, but they're widely available, and I can see why people get confused because it says N95 on here.
Tell me about this, because people ask this question all the time. Does somebody in the general public need to wear an N95 mask at all?
You really don't. No. I mean, there's really no reason for you to wear an N95 unless you're a healthcare worker or you're somebody going to somebody's home and you know that they have COVID, whatnot. There's no reason for you to wear an N95 mask, and those really can be more restrictive in terms of your airflow. If you have an underlying history of asthma or COPD, they can be more restrictive in terms of getting oxygen and everything in there.
We would say, for the most part, I think an N95 mask should be reserved for healthcare professionals, unless you're somebody in the public that is very high risk. If you're older, if you have underlying respiratory issues or other medical comorbidities, maybe you would say you could wear an N95 mask. But for the general public, a regular surgical mask
Yeah.
or face covering is all.
And
you
don't
need.
wear the one valve mask.
For sure.
And if you're that high risk anyway, you probably shouldn't be going out into crowded areas anyway. The best kind of mask you can
Yeah.
wear though
Oh,
is the stamped, branded HHDPC mask.
wow. Great advertising.
Free with membership. We're here for you guys. Dr. Amy Ostick, Health and Healing Direct Primary Care. We just wanted to touch base with you to talk about universal masking and why it's really important. And I know and I understand that this is a very emotionally fatiguing time. And if you do need help talking about this, if you feel like there's a lot of anxiety, if you're going through a stressful time or a traumatic situation, please reach out. We're here too. We have counseling services available to all of our patients at a reduced rate. 818-600-2426, and that's healthandhealingdpc.com. Thanks, Dr. Brian.
Thanks, Dr. Amy.